everyone, welcome to my channel. Let's talk about cancer. In this video we talk about cancers of the larynx and their treatment. So cancers of the larynx can occur at the vocal cords above or below. So larynx involves a lot of components which help us in speech and which prevents the food from entering into the windpipe. So this is all enclosed within a cartilage, which is the main important supporting structure for our voice box. So when these tumors are small or limited to one side or not eroded into this cartilage, they are usually treated by either laser or by chemotherapy and radiation combined or radiation alone to make sure that the cancer is treated and cured completely. The patient is cured completely from the disease and at the same time retaining the voice box and the vocal cords, so speech is not affected. But at times the tumor becomes big and erodes or it infiltrates into the cartilage or comes out of the cartilage, in which case it is not possible to save the voice box completely. In these patients, we'll have to remove the voice box and make sure there is a separate passage in which they are able to eat comfortably, and there have to be a permanent hole in the neck for them to be able to breathe, because once the voice box is removed, airway is separated from the eating passage. This is called as a permanent tracheostomy. Many patients do find it difficult to understand and difficult to accept that they will have to live with a permanent tracheostomy, they will not be able to speak because of this surgery. But it is most important that the cancer is removed completely and everything else becomes secondary to this. So even when the voice box is removed completely and a permanent tracheostomy is made for them to breathe here, we can insert valves between the windpipe and the foot pipe, through which the patient goes through a rehabilitation process and they are taught to talk, but in a slightly different way. Most patients who are willing to make the effort and are willing to learn how to talk afresh are able to do so comfortably with the new techniques that they are taught. There are many different avenues which help them talk like this, like a valve or an electric voice box, by which they are still able to retain their function of speech. Swallowing usually is not a problem because their foot pipe is retained and it is intact, which can be made afresh with some form of flap as well. So this is about cancer of the larynx. If early, it is treated with radiation or some form of minimalistic surgery, or if it's advanced, requires a radical surgery, but still it can be cured and there is a good outcome in such patients. Thank you.